AFRL and the 7-Eleven were asked to support both operations for COVID-19, but also looking at a kit on what R&D solutions do we have to support some of the needs and gaps that they identified with the COVID-19 pandemic, whether it's in diagnostics, whether it's in decontamination, whether it's in patient movement, whether it's providing consultation, because of its multidisciplinary workforce that it brings to bear to solve problems. I think there's a natural tendency to come to AFRL to help solve this crisis or the challenges that the nation faces and the DoD faces with COVID-19. And particularly the 7-Eleven Performance Wing, because of our role with our alignment to the line of the Air Force, but also functional alignment to the Surgeon General, addressing the medical needs of our service as well as the joint community. I think we're a unique space. We have 70 different disciplines in this organization, all the way from our medical professionals to engineers, computational scientists, chemists, biochemists in the organization that all can be pulled together in a multidisciplinary approach to address some of those questions. We have been supporting Operation Warp Speed in two specific areas. One is looking at emerging technologies for diagnostics, as well as supporting testing capabilities, right? How can you bring cutting edge sequencing capabilities to help with testing? How to do surveillance to support the readiness mission of the DoD? How do you bring in new technology solutions? Also, how do you assess some of these new diagnostic kits that have been developed, right? What is the true performance parameters of those kits and how they could be employed within our environments? We're able to look at the problem in a very different manner than you would traditionally look at, maybe looking through a very multifaceted lens to see what are the kind of solutions and what are the kind of things that we have within our kit that can help solve those problems. So in some cases, we're able to pivot. The organization has been working quite a bit on directed energy and the effects of directed energy on humans, right? In things like lasers and other things and RF frequencies. But then, using that knowledge, can you use that same tool to inactivate a virus? We've been working in the area of wearable sensors for monitoring pilots and our aircrew, looking for safety reasons. But how can you use that same technology and apply that to monitor individuals who might be exhibiting symptoms of COVID-19? Can you look at things like heart rate and O2 levels and maybe the intensity of breathing and of course body temperature too, as well as indicators of COVID-19 infection? The unique structure of the 7-Eleven Performance Wing, the ability of the Airman Systems Directorate to come together with the School of Aerospace Medicine to work to collaborate together to address some of those questions, I think provides a very unique opportunity. But we also work with academia and industry, leverage the best of breed technologies to provide solutions. When we get a problem from the field, we have to look at the whole gamut, right? This could be about education and training. This could be maybe you have to provide some protective gear, the ability to provide solutions to our warfighters, especially in terms of the COVID-19 pandemic, to be able to ensure readiness, develop some of the same things that we've been working on for other aspects because of the talent that we have, the diversity of thought that we bring to bear that allows us to quickly address some of those problems. It's all of us. We're all in it together, and we know that, and we're here for a purpose, as that's to support the warfighter.